Good afternoon, everybody. This is Betsy. Welcome and thank you for being here today. Sorry we just got started a couple of minutes late. The focus of our talk is going to be on charter sustainability, and together we're going to review how to use your charters to facilitate and drive quality improvement at your center, as well as also how to sustain those charters. So here's our agenda. It includes a charter overview. And again, as I said, our focus today is going to be on the sustainability of charters and QI projects, charter audits, and then a QA at the end. So I know many of you have seen these tables, but again, I just wanted to share these. So our SVS VQI centers work on quality improvement projects throughout the year. And last year we had 74 charters. And I do want to point out that 4 centers did 2 or more charters last year. So kudos to them. And then you'll see a historical review of the charters from 2018 to 2021. The topics are broken down into long-term follow-up, DC meds, documentation, clinical, and other. The other represents a blend of 2 or 3 of the mentioned topics. For example, long-term follow-up with clinical or DC meds and documentation. So as I mentioned, we had 74 charters last year. As of today, July 26, we're already at 50 charters. So again, thank you so much for your hard work and dedication. It truly is showing. So charters can be individual or regional. They must be VQI data-based. When developing a charter, I always recommend using a blank charter as a guide. You'll need to build a team, set an obtainable goal, set milestones, review your resources, submit your charter to me, make a difference, and then share your story. So the first step to begin a charter is to review your data to obtain your ideas. Excuse me. Other important things to consider would be to think about who you want to be on your team and think outside the box. Consider having a champion on your team. It could be a nurse, a physician, a tech. What is your goal? What do you want to answer, change, or improve upon? And how will you obtain stakeholder buy-in? And lastly, is it sustainable? While the regional reports remain an important emphasis for the VQI's quality mission, the dashboards also represent a wealth of information that can be used in tandem or entirely separate from the regional reports to aid in your center's quality improvement efforts. So I want to encourage you to use your dashboards and/or regional reports for your charters. As you can see on the screen here, our regional quality reports, again, they are our cornerstone. They have 23 key targeted measures. But our dashboards, again, they're a wealth of information and they have over 200 measures. So here's a snapshot of 3 dashboards provided by Christopher, our statistician. So look at your dashboards. Where are your barriers, your outliers, and your obstacles? So write down your thoughts, investigate, review your past reports. Again, look at your dashboards and look at the whole picture. So once you've determined the focus, drill down even further using the dashboard again and do your homework. Here, reviewing the EVAR dashboard, you can look at length of stay, surgical site infections, MI, dysrhythmia, CHF, any stroke, new dialysis, reintervention, and these are just a few things just to get you started, just to name a few ideas. And you can see here, I'll show you a picture in just a moment, but at VQI at VAM this year, we had a poster that used VQI modules to identify modifiable risk factors associated with post-op arrhythmia. Here are the authors, and they used data from 6 VQI registries, EVAR, Open AAA, infrainguinal, suprainguinal, and then the carotid registries to identify variables associated with incident post-op arrhythmias. Oops. And then here they are talking about their poster, VQI at BAM. And you can see the great networking opportunities that occur at our poster networking reception on Tuesday evenings every year. This is one of my favorite quotes that Henry Ford wrote. Quality is what we do when no one is watching. And I think that's just something that's just powerful that truly speaks to me. So let's discuss sustainability in depth. So, what makes quality improvement so important? There are several reasons to work toward quality within your center today. Those include patient outcomes, gaps in care, return on investment, and external pressures. Quality begins with the responsibility to our patients. So, gaps in care can include science where insights may be poorly managed, evidence that is poorly utilized, care with experience that is poorly captured, in which all of these affect patient care and outcomes. So, gaps in care can cause missed opportunities, waste, and even harm. So, return on investment is very, very important. This can be various things. It can be reduced use of resources, reduced length of stay, reduced complications. Rough estimations are still useful, and remember, investment savings are not only for money, but also time and resources. Modest cost savings per patient can equal significant aggregate gains. I did find a nice ROI calculation tool from the AHRQ that you can download, and I'm actually going to have it available to you after this webinar. And it can actually assist you in determining your own return on investment. It's a 14-page document um, that I've used in the past when I was at the bedside and did a couple of return on investment savings and charters of my own. But it's great because it's geared toward healthcare workers. And again, I'm not, not branding it or anything like that. It's just a great AHRQ ROI document for us. So anything that I have that I can share, that's one thing you will find about me. I like to give back to all of my coworkers, such as you. So anyway, that will be available after today's webinar. So I wanted to share a couple more posters and kind of give you examples of return on investments. This was another poster, Process Improvement Initiative to Reduce Surgical Site Infections in Lower Leg Amputations. You'll see the authors here. And the key stakeholders, including vascular infectious disease, endocrinology, anesthesiology, nursing, and pharmacy, identified 3 opportunities to improve care. Those included peri-op glucose control, pre-op antibiotic, and chlorhexidine bathing. So with that being said, their return on investment was decreased length of stay. They decreased their surgical site infections, obviously. So they decreased readmissions. They increased their patient satisfaction. They increased their physician and clinician satisfaction. There's just a whole host of different ROIs. So think about things outside the box. It doesn't just have to be money and cost savings again, but also time and your resources. Think about that glucose control. Think about that pre-op antibiotic. So just make sure you think outside the box. And again, here are the ladies at their poster, and they're sharing their findings with them. You can see that they have some wonderful graphs that they were explaining and sharing, again, during the Tuesday night poster session. Another return on investment poster that was shared this year was length of stay following major amputations, a problem analysis. And you see the authors there. And then from this problem analysis, the model for improvement is being applied to initiatives such as decreasing time from operation to PT/OT evaluations. They actually standardize a post-op order set. They reduce their workflow inefficiencies by allowing PT and OT directly to communicate discharge recommendations via their social worker and care management orders. And they improve their interdisciplinary care communication via the development of a care coordination dashboard. So again, they took a different route for their return on investment. So not only did they decrease their length of stay, but check that out. They did order sets, they improved their workflow, and they improved their interdisciplinary care and communication. So again, return on investment does not have to be about specific money, but time and resources. I can't stress that enough. And again, that's Dr. Benaroche Campbell and Dr. West, again, sharing their findings on their poster on that Tuesday poster session. So while ultimately we should be motivated to improve the quality for the sake of our patients, we all know that we cannot ignore the pressure that we have from external government and professional bodies that regulate, accredit, and rate our own institutions. So these are just a couple of examples of the different types of external accountabilities that we see. For regulation, CMS or Medicare, Medicaid. Standard setting, we see evidence-based guidelines, AHRQ, quality indicators. Accreditation, you have certification, JCO, and then of course you've got your quality scores and patient ratings, your patient satisfaction scores. So again, I wanted to highlight a couple of posters again from this year from VQI BAM. And the first one was using vascular quality initiative to support the vein center accreditation. You see the authors there. And they incorporated the use of VQI's varicose vein module to support the quality improvement and IAC vein center accreditation processes. So they used this for the accreditation. And this poster actually won the PSO Director Award for the year. And then there's the two wonderful ladies. That is me in the middle. And then the second poster that I wanted to highlight was the use of VQI registry to implement appropriate use criteria for atherectomy and peripheral vascular intervention. You see the authors there. And then this was a system-wide initiative using VQI PVI registry data that can be used to implement AUC for atherectomy devices and vascular interventions. Physician education and consistent messaging at their PI meetings ensured compliance and guidelines for patient care and cost savings to the health system. And this poster actually won this was the favorite poster that was voted on. And so that's by Lillian. Most people know Lillian Camino. So that's Lillian. And again, so I just wanted to point those out. So those were basically two posters that were for the external government examples. So different stakeholders at your institution are going to have different motivations for investing time, money, resources, and quality improvement. So I just want to suggest that you get to know your stakeholders. Do they align with your center mission and vision? So why do quality improvement? You can improve patient outcomes. You can close those gaps in care. You can yield a positive return on investment and respond to external pressure. So a couple of questions that I'd like to challenge you with is what motivates your center? What motivates your leadership? So how are you going to get stakeholder buy-in? So those are just a couple of things to consider and think about whenever you're really, doing your charters and thinking about sustainability down the road. So how do you sustain and continue your QI project in charters? I think this picture kind of says it all. It takes a team to nurture and cultivate a QI project and charter. You need to communicate with all stakeholders, provide updates, and they can be quarterly or annually. Grow your team. And if someone leaves, replace them or add someone new with fresh ideas. Celebrate the small milestones, such as we've maintained long-term follow-up at 92% for 2 years. Don't put your project on a shelf to collect dust. Keep it fresh. Educate others. Mentor them on your center project. Are they a new stakeholder? Are they a new employee? What's next? What else can be done for the project? Or for this project, from this project, or as a fresh project. And sustainability examples might include satisfaction surveys. You may do this for patients and or staff, depending upon your project. Do updates at staff meetings, updates at C-suite meetings. Present at your spring and fall regional meetings. present a poster, or do a podium presentation at VQI at BAM and or other conferences within your region. There are so many opportunities for sustainability. Make sure you think outside the box. And if you can't think of anything, contact me, I'll help you. So, what is your QI project? How will you sustain it? How will you grow it? Don't be afraid to ask your stakeholders what their vision might be and what they see your project going and where. And I just wanted to share that make sure you visit the website. What is your story? Consider sharing it. Contact me. And we are going to be accepting our poster submissions early spring. And make sure you save the date for our 2023 annual meeting. It's going to be here at National Harbor in DC time area. It is National Harbor in Maryland, but it is in the DC area. It's at the Gaylord next year, June 14th and 15th. And then I wanted to let everybody know that I have begun some charter audits. My goal is just starting with 10% of charters per year. It's simply an email or a phone call or both, and I'm basically just checking in and inquiring how your QI project's going. Is it sustained? Do we need to update it? Do we need to tweak it a little? Or is it going fine and we just don't need to change it at all? This audit is simply a check-in from me to you. It's random, it's not punitive, and again, it's just something that I wanted to do to find out how the charter is going. You know, do we need to tweak the form a little bit? Is it useful? Is it not useful? I just want to hear from you. And so I thought doing 10% in the beginning of the year for as a start would be something that would be sustainable and doable. And so I've already met with 4 this year so far, and we've tweaked a couple, and one we haven't done anything with because it was going well. And then the other one, we're going to look at it again in another 3 months. So again, this is just a random charter audit, just a check in from me to you. And that's it. So that's it for our webinar today. And so we're going to go ahead and start taking questions in the Q&A, if I can get it to work. Oh, so can you share some long-term follow-up ideas that work? The long-term follow-up ideas are going to be basically dependent upon the center. So Stephanie, I am going to reach out to you specifically, and I can give you some examples, but I can tell you that there are some charter samples online that you can look at. I'm also getting permission to post others on that. But for long-term follow-up, look at your center and see where you are. I was working with someone today and they were at 4% long-term follow-up. And they met as a team and they started talking. They had 90 long-term follow-up to do. And they basically divided it up as a team, met and divided it up as a team, determined they could do so many per day, which, you know, allotted so many per week. And they worked together and they got it up to 51%. And so I told them, you know what, 50%, 51% is an excellent start, and to celebrate that success. And so today they sent me a screenshot of them being at 51%. And I told them that was fantastic to go from 4 to 51% in 2 months. I thought that was wonderful. So again, it just depends on where you are as at your center. So you kind of have to look at the big picture. You have to look at how many data abstractors you have, how much workload is going on. You know, do you have someone that is specifically designated for long-term follow-up? There's a lot that kind of goes into long-term follow-up, and I know COVID is a big thing going on. So sure. Can you go over continuing a charter and submitting the continuing charter? So once you start a charter can be, oh, I'm sorry, trying to write down, my pen just gave out. Once you start a charter and it's approved by me, so you start a charter, you submit it to me and I review it and make sure, there's a nice goal, a scope, you're using VQI data. We communicate back and forth via email or phone, either or. It's accepted. So I say, okay, it's accepted for 2022. If it goes into 2023, for example, Melinda and I are going to chat. Melinda, does your charter need to go into 2023? Yes. Okay. Well, can you explain why? Melinda tells me why. So I'll have Melinda fill out what we have as the supplemental charter form. That is just a smaller version of the original charter form. So it's just basically it's ongoing charter from the primary charter of 2022. And so she just has to submit that supplemental charter, and I know the rationale why it just needs to, continue on. It's ongoing. Like maybe her long-term follow-up, they only met, we'll say 51%. And so they want to continue improving upon that long-term follow-up, and they're going to make 75% this year. So all Melinda has to do is contact me. We go over it. I approve it. She fills out the supplemental charter and I accept it. So that would be a continuing charter for another year. Original charters can continue up to 3 years, but they have to be approved by me and you have to fill out the supplemental form for the following 2 years. So you'll fill out the original charter form the first year and then a supplemental charter form the next 2 years. But we just have to touch base the second and third year. Does that make sense, Melinda? Okay. And then also, I do want to point out there are some centers that do more than one charter. Um, each center gets participation points for one charter per year. And that is where it stands as of right now. I did take that to the participation committee last fall, and we felt that just one charter per center per year is where it stands as of right now. There are some centers that give me 2 and 3 charters per year, and that's wonderful. Um, they have the time and motivation to do that, and so we just keep it on the books for them, and that is perfectly acceptable. When is the best time to start on a charter? You can start on a charter anytime you want to do it. Um, I accept charters up until December 31st at 11:59 p.m. It's never too late in the year to start a charter. And that's also another example, Barbara. If you started a charter like late in the fall, but it's a great charter, you really want to get this going and, start it, you can start it. And then you would just fill out the supplemental charter for 2023. So you just have to show that you were working on it in 2022. Sometimes, we have staff turnover or new staff begin, and they want to start a quality project in the fall and get things going. Sometimes that's just the best time. You know, elective procedures are sometimes down, sometimes up, depending upon people's insurance, whether they want to try and get those last procedures in for the year or not. Any other questions? Where's the best place to find the best practices for these procedures? Um, the SVS, that's where we house all of our, the articles and best practices and everything. I do keep, um, like the nursing, the DMAIC and different things like that on the VQI website, but we always say look for the AUC and all of those journals and articles on the main hub on the SVS. All right. Well, I think with that, whoops, there may be one more. Oh, can we see recordings of the live presentations? Yeah, Lillian, you sure can. So you just need to go back. Oh, Jen, you may need to help me with this. Um, s- what is it? Sign in, like you're going to,
Yep. So the VQI at VAM recordings are all available on the online planner on the SVS site, and that's on vascular.org. If you click on, you'll be able to click on VAM 2022, and then from there you'll see a block that says Vascular Quality Initiative, and you'll want to click on that. And then use the same login you used to register for the event, and you should be able to see the slide decks as well as the recordings for both days.
awesome. Thank you, Jen.
Yeah.
All right. Well, with that, we hope you have a wonderful Tuesday afternoon, and thank you so much for joining us. I did want to share, our website is being completely overhauled, and so in October we're going to do a live presentation. Jen and I are going to do a live presentation of the website, so we'll be able to show you where the quality aspects are, and that's what's going on in October. And we'll definitely have some more slides and things of that nature, but we're going to do a live presentation in October of the new website. So, uh, Holly, we don't do continuing education certificates on these little webinars. So sorry. You're welcome. But Holly, you do get CME CE credits on the regional meetings twice a year. So make sure you attend those. You get two per meeting. So make sure to attend those, and those are free. I know us nurses have to stick together. Oh, I'm glad, Catherine. I think it'll be nice to review the website live together too. So, and we'll do some slides too, just to make sure that in case anybody can't attend, there'll be some slides to reflect what we show too. So, all right. Well, thank you all for joining us. I hope you have a great Tuesday afternoon. Take care, everybody.